Reserval of TGFBI-Driven profibrotic state in patients with pulmonary fibrosis. Definition: Pulmonary fibrosis is an interstitial lung disease characterized by the replacement of lung tissue by colon tissue. PF normally affect adults between the ages of 15 and 17, particularly those with a history of smoking and a greater number of men than women.
I couldn't walk from the back door of my house to the garage without taking a break. That's what pulmonary fibrosis did to me. I was diagnosed with idiopathic pulmonary fibrosis, also known as IPF, in 2008. IPF causes scarring and hardening in the lungs and makes it very difficult to breathe. With IPF, there's no known cause or cure. When I was first diagnosed with IPF, I was really lost. You don't know which way to go, which way to turn, and I want to share with others what I've learned about living with IPF. With pulmonary fibrosis, it's just so hard to breathe. It just takes so much out of you. You feel like giving up, but you just can't do it. You've got to stay active. You've got to keep moving. For me, that was the most important thing.
Application in nursing, respiratory monitoring, oxygen therapy, medication administration, pain management, health ventilation, airway management, and aspiration of the airways.
My first knowledge about this was in January of 2011. I'd had some shortness of breath, but I honestly thought it was because I was overweight and out of shape. But I had gone for my annual physical, and the doctor told me, he said, "Pat, I hear some crackling in your lungs. I'd like you to get a chest x-ray." So I got the chest x-ray, and he said, "We have a specialist at our Austell office, and I'd like for you to see her." So I made an appointment at Georgia Lung, went through a battery of tests, and it was in March of 2012 that my wife and I met with her, where she began to explain what happens with the fibrosis. And I said, "Okay, let's get down to the nitty gritty." Because she was very honest. They don't know what causes it, and there is no cure for it.
Pros and cons. Pros. How do people with these diseases live? Just over 40 years. It's very rare in people of age in these incomes. Cause organ and tissue damage, especially in the lungs and the gastric tract. Some patients need a lung transplant. It can cause heart failure and massive recurring bleeding from the airway.
The American Thoracic Society, European Respiratory Society, Japanese Respiratory Society, and Latin American Thoracic Society have published a new clinical practice guideline to help physicians diagnose idiopathic pulmonary fibrosis. IPF is the most common and deadly form of a group of more than 200 conditions known broadly as interstitial lung disease. Most often, IPF is diagnosed in adults over age 60, and more often in men than women. The median survival is 3 to 5 years after diagnosis. Symptoms due to low oxygen levels include shortness of breath, dry cough. Diagnosing IPF is challenging because these symptoms are nonspecific. They occur with all interstitial lung diseases and with other respiratory problems. Because drugs may slow the progression of IPF, an early and accurate diagnosis is essential for prompt and appropriate treatment for this fatal disease. The 29-member guideline committee discussed the findings of all accumulated evidence pertinent to 6 clinical questions about the diagnosis IPF and rated the quality of the evidence using the grading of recommendations, assessment, development.
In supply in Ecuador, patients with pulmonary fibrosis are cared for in Guayaquil, a pediatric hospital, Francisco de Casa Bustamante of the Ministry of Public Health, and Roberto Gilbert Hospital of the Junta Beneficencia de Guayaquil. 20% of patients are middle class and 80% are poor and extremely poor.
Idiopathic pulmonary fibrosis is a disease which causes progressive scarring of the lungs. So patients develop breathlessness, which gets worse over time, and ultimately they develop respiratory failure. Until 2 years ago, there weren't any available treatments in the UK, but fortunately that's begun to change. So clinical trials have seen the development of 2 new drugs which have now been approved for treatment in the UK, and both of which are now available for patients with idiopathic pulmonary fibrosis. The Interstitial Lung Disease Unit at the Royal Brompton has been running for over 40 years, and as a consequence we have the largest clinical service in the UK. We see on average 1,000 new patients a year and have under follow-up somewhere between 4,000 and 6,000 patients at any one time. Having so many patients under our care has provided us the fantastic opportunity of being able to conduct clinical.
Conclusion: pulmonary fibrosis continues to be a great diagnostic and therapeutic challenge in our environment, so we must treat and ever increase survival and overall to ensure a quality of life comparable to normal in our pulmonary fibrosis patients.
Idiopathic pulmonary fibrosis can be broken down into idiopathic, which means a disease without a known cause or mechanism, pulmonary, which refers to the lungs, and fibrosis, which refers to excess collagen in connective tissue or interstitial tissue between cells, usually after tissue damage. So idiopathic pulmonary fibrosis is the ongoing repair process of having excess collagen or scar tissue in the interstitial tissue of the lung. What triggers the repair process is unknown, but it's a chronic process that leads to a progressive loss of lung tissue. Watch the full video on osmosis.org.